So I am recording. I am sharing screen. And so here we go. Okay. So we talked about this already. We talked about this in maybe like the very first day of class. Okay. But remember that cardiorespiratory fitness, or in this instance, we may sometimes abbreviate it as CRF, okay, has a very, I cannot emphasize this enough, a very strong relationship with overall mortality risk, okay? So your endurance capacity, which is related to cardiovascular function, pulmonary function, and then kind of metabolic function in a muscle, is the single best predictor in a lot of ways of mortality risk, okay? So if you guys want to do something today to reduce your risk of dying from anything, go for a run or a bike, or I guess you can get on the elliptical or something like that, okay? So that's kind of our starting place. We need to know and understand that this is a big deal, okay? Additionally, remember, and we mentioned this already, but I'm gonna bring it up again, is that higher levels of cardiorespiratory fitness, okay, can offset a lot of the increases in mortality risk that are associated with being overweight and obese, okay? So if we have to pick something, okay, don't worry as much about going to Chick-fil-A and getting a #1 and a large strawberry milkshake, okay, which is my preferred way of doing things, okay? That's not great for us, but if I go run today, then that's going to offset a fair amount of the potential kind of negative consequences of all of that. So if you've got to pick something, okay, losing weight is helpful from if you're overweight and obese from a mortality risk standpoint, but doing physical activity, doing exercise to raise cardiorespiratory fitness is a way more powerful kind of thing to reduce mortality risk, okay? So now, the kind of more nuanced way to look at that as well, though, is that when we look at mortality rates within a given body mass index group, okay? So if you guys remember, we have the buckets of body mass index. We have kind of underweight, which is not great. We have normal weight, we have overweight, and then we have obese. And as we get from normal into overweight and obese, then our mortality risk is going to increase, okay? However, if you look within a given BMI group, and we stratify people based upon their cardiorespiratory fitness, even people that are in like the normal weight group, if you have a higher cardiorespiratory fitness, you have lower mortality risk than people that are also in the normal weight group but have lower cardiorespiratory fitness, okay? So even if you're sort of not necessarily at an increased risk by your weight status, being more fit is actually a better thing, okay? So that probably makes kind of very obvious sense to everyone, but I really like to reintroduce that as the big picture kind of clinical outcome for all of us with these things, okay? Here you guys can see, right, this is a graph that we had already shown, and if we're looking at this, that here on this end, these are our least fit people, here are our most fit people down there, and then here's your relative risk of mortality on the y-axis. Then what we see is we're really going to look at and talk about today this graph here, okay? The fitness side of things, the fitness side. And so I know we introed this, but we're going to spend some time now going into a little bit more depth on something. Our measurement, the variable that we're going to talk about, which is the gold standard measure of cardiorespiratory fitness, is something called VO2 max, okay? VO2 max. And so the V stands for volume, the O stands as the O2 is for oxygen, all right? And so what this tells us is the volume of oxygen that we can bring in from the atmosphere into our lungs, diffuse onto hemoglobin in our blood, okay, and then send out into the body via cardiac output. and then diffuse from the capillaries into metabolically active tissue, which during exercise is mostly muscle, okay? And then that once it gets into the muscle can be used by mitochondria to make ATP. So what this is really getting at is this is what we would call an integrative measure, okay? Because it's integrative because we need good function, or the function of VO2 max is affected by the function of multiple physiological systems, okay? It is in some ways dependent upon how much oxygen is in the air, but we don't have a lot of control over that. But it depends upon pulmonary function. It depends upon cardiovascular system function. It depends upon our ability to direct blood flow to the correct tissues. It depends upon how many capillaries we have to be able to get that blood, okay, from the cardiovascular system into close contact with the metabolically active system. And then how many mitochondria we have in those tissues that want to take that oxygen in and then be able to make ATP out of it, okay? So all of those things are going to play some role in determining what a person's VO2 max is. So you can imagine if I have some kind of problem in a pulmonary system, my VO2 max goes down. If I have a problem and I have improper function in my cardiovascular system, my VO2 max goes down, okay? If I don't have very many mitochondria in my skeletal muscle, or I don't have very many mitochondria or some kind of impaired mitochondria in my cardiac muscle or in the neurons in my brain, then my VO2 max goes down. And so this is why it's such a good predictor of mortality risk, is because it is integrative, because it's going to tell us things about the functioning of multiple physiological systems, which can, all of which have their own kind of unique pathologies that may affect things. Okay, so before we jump into a little bit more on the things about VO2 max, I also want to just mention things that are probably very obvious to all of you guys, but I think it's useful for us to state these kinds of things, okay? So why would it be useful? We're gonna talk about kind of what goes into VO2 max, but then we're gonna talk about how we test for it, okay? And then as part of our lab number 2, we're going to do a test. We're going to do something to test VO2 max in all of you guys, okay? So why would we want to know that? Okay, well, the primary reason that we want to know things is that it lets us identify your current physiological level of fitness, okay? We need to know who has a higher level of fitness. And that's going to tell us some things about not just your mortality risk, but who's going to be a better endurance athlete, who could run farther or run faster, or who could bike at a higher power output, et cetera, okay? It also can give us kind of a jumping off point for exercise programming, okay? VO2 max is going to function from prescribing aerobic exercise intensity as our analog to 1 rep max, or the MVC, the maximum voluntary contraction. If I know what your maximal sort of oxygen consumption is, I want to tell you to go exercise today at some percentage of that in order to make sure that it is intense enough that we evoke some adaptations, okay? That we can evoke some adaptations. We can also use it to screen for coronary artery disease, which we'll talk about when we get into cardiovascular disease. But generally, people that have a low VO2 max probably have some kind of coronary artery disease. Also, the test that we use, like in a lab, or if you go to the hospital and they test you, the test that we do to get that number, if you have coronary artery disease or you have impairment in blood flow in your heart, it may actually evoke some very distinct symptoms that let us know that that's what's going on. So we'll talk a lot more about that when we get into cardiovascular, but it's very useful from that standpoint. Okay. We have been asked at various points to perform VO2 max and strength testing on folks that work at the university. And you need a certain level of VO2 max, just like you need a certain level of strength to be able to perform certain work tasks. And so it's sometimes used by people in human resources and things to make sure that if people have been recovering from an injury, or if they've had a heart attack or something, they want to go back to work, especially if their work involves moving, lifting, carrying things, kind of more manual types of labor, then they need a certain level of fitness to be able to safely perform those tasks. And so we've been asked to actually do that and determine, do they have enough ability to do these kinds of things? Okay. And then, you know, much like we can do when we look at prescription, we figure out what your fitness level is, we prescribe some exercise, you train for a while, and then we can retest you and we can use those results to make some decision on, well, is our training program working? Is it not working? And if it is or isn't, how might we want to change it kind of going forward? Okay. So there's some really interesting and I think important reasons that we want to test for these kinds of things. Okay. So I mentioned in kind of 2 slides ago some of the things that are going to get at what VO2 max is, okay? But the really key thing is that it's this integrative measure that's going to encompass kind of all of these things, okay? So if we want to try to understand, okay, if we want to try to understand some of this integrated physiology that underlies your cardiorespiratory fitness, one of the best places to start is with something called the Fick equation, okay? And so the Fick equation is a way for us to try to mathematically explain what your oxygen consumption is at any given moment, okay? So what I should probably do first here is tell you guys that while VO2 max is the maximum level of things, okay? This is how truly fit, what's the highest level of something that you can do. All of you right now are consuming oxygen and making ATP, okay? So in other ways, we can use oxygen consumption as a measure of metabolic rate. And so all of you right now have some level of oxygen consumption that's going on. It's dependent upon what your muscle mass is. It's dependent upon, you know, whether you're laying in bed or you're standing or you just had breakfast or if you've already worked out this morning. It can depend upon a host of different things, okay? But if I want to know what your oxygen consumption level is at any moment in time, be that at rest, during walking, during jogging, or sort of during all out maximal kind of exercise, I can calculate that if I know your cardiac output, so your heart rate and your stroke volume. Okay, so if I know cardiac output and I know your AVO2 difference, okay, so if I know how much blood is being circulated per minute, and I know how much oxygen you're taking out of that blood, then I can then use that to calculate how much it is that we in theory think you're using in your tissues. Okay. So when you're resting, your VO2 is relatively low. Your heart rate is lower, your stroke volume is lower, so your cardiac output is lower. Okay. The arterial side of AVO2 difference, so the A portion here is very much going to be linked to pulmonary function and our ability to get oxygen on the hemoglobin. The venous side of things is really kind of integrated into the ability of our blood vessels to get that blood to muscles, okay, and the ability of the muscles to be able to extract it and pull it out and do something with it, okay? And so we have cardiovascular system function from cardiac output, and then we have pulmonary function and kind of hemoglobin on the arterial side, and then muscle function things on the venous side. So this is our way to describe this integrated function, okay? So you can imagine then if we want to know what your maximal oxygen consumption is, we need to know then what's your max heart rate, what's your max stroke volume, so what is your maximum cardiac output, and then what is your maximal ability to be able to extract oxygen out of capillary blood, and then be able to use it in your muscles, okay? So that's how we can try to explain all of this. And you guys will do a whole lot more with this again in exercise physiology class. You kind of break these things down more so into their individual components. But I want to introduce it because when we talk about people that age, when we talk about people that are sedentary, we talk about people that have a pulmonary or a cardiovascular pathology, then you can go back to the Fick equation and understand why their VO2 max is going to be lower or why doing certain tasks are going to be more difficult for them. Okay, so the gold standard way to test for this is I put you on a treadmill. Okay, I put you on a treadmill and then I give you a mouthpiece, and I'm going to collect all of the air that you're breathing out, and I'm going to run that air through something called a metabolic cart. And when I have you on the treadmill, we are going to have you maybe either start off walking and walk at a certain speed for a little while, and then we're going to gradually increase that walking speed until you jog, and then we're going to have you jog faster. So we're making the exercise intensity kind of progressively go up. Or maybe I'm going to have you with you guys, we would have you guys jog, and we would start on level, and we would just gradually every couple of minutes start increasing the incline on the treadmill. And we basically have you run or walk until you cannot continue going. And so what we see when we do all of this, and the graph that is on here was done on a bicycle because it has work rate in watts. But as we increase work rate, as the resistance on the bike goes up over time, what you note is this very sort of linear increase in what we're measuring as the amount of oxygen that you're using in your muscles. Okay. This corresponds very nicely with the increase in heart rate or the increase in cardiac output or the increase in VO2 difference that they're going to increase with increase in exercise intensity. At some point in an ideal world, this will plateau. We will get you to a place where we will make the incline go up, we'll make you work harder, and there will be no further increase in the amount of oxygen that you're able to take in and use. You can continue exercising. You can continue to do a higher intensity of exercise potentially because you have anaerobic sources of ATP that will allow you to continue for some kind of short-term finite period of time, but we've maxed out the aerobic system. In practice, this very, very, very rarely ever happens. There's some kind of interesting things that we can do to try to manipulate that. But for the most part, we just say go until you can't go anymore, and we're going to take the highest value that you have, and we're going to call that your VO2 max. Okay. I can tell you, as someone that has done this test quite a bit, this test sucks. Okay. It sucks. It's really, really difficult. And you have to be very motivated, especially during like the last, say, 60 to 90 seconds of it. It's very, very uncomfortable. You're just running or cycling basically as hard as you can go until you can't keep up anymore. And so it's a very arduous task. And so there are some difficulties with doing this. It's hard for us to do this particular test in everyone. Okay. And it's not even something that we would do in our normal lab as part of our class. And we'll talk about kind of, if this one is hard, then what are some alternatives for us to be able to do to kind of get an estimate of what this number is without having to put people through all of these kinds of things. Okay. So before we get into some of that, I want to introduce some numbers for you guys. Okay. And these are some details and some numbers that I absolutely 100% want you guys to know on everything. Okay. And so what we have here is average values. Okay. So this first spot here, this is average values for people that are, say, maybe 18 to 30 years old. So for women, the values are maybe 30 to 40. And then in men, they're maybe 35 to 45. And so the units that we have on all of this are milliliters of oxygen per kilogram of body weight, okay, per minute. So it's how many milliliters of oxygen per kilogram of body weight are you consuming? So how much oxygen do you need to make ATP per kilogram of body weight over the course of 1 minute? Okay. And so there's a lot of reasons why we do this and why we normalize it to body weight so we can compare men and women and bigger people and smaller people. There's a lot of stuff with that. Again, those are things that are very, very important, but they're a little bit beyond the scope of our class. And you guys will do more of that in exercise phys or in exercise testing and prescription or the exercise physiology lab class. Y'all will go into kind of the hows and whys of those things. So those numbers aren't necessarily meaning this, just what those numbers are. Okay. You guys will note that in women, they tend to be a little bit lower than they are in men. And so what I'm curious about is, does anybody want to guess why that's the case? Why do we think the values are lower on average in women than they are in men?
Does it have to do with the amount of blood in the body, since VO2 max is calculated? So women, every month we lose blood, so then the cardiac output is going to be lower, which then
Okay.
is going to make the VO2 max lower.
So that's a really interesting idea, Julia. That is actually, because we normalize it to weight, blood volume tends to be related to kind of body size. And so that tends to get washed out. But in an absolute sense, absolutely, people that have less blood will tend to have lower VO2 max values. And every month, yes, you guys do tend to, or I guess it might not be every month, depending upon sort of what, if you're taking certain kinds of birth control or if you're pregnant or something, or how regular you are. You guys do lose blood when you have your period every month, but it's probably not enough to make a, I know that it's not enough to make a huge difference. We actually had a student in Dr. Larson's lab that did a study on the changes, does VO2 max change across menstrual cycle phase. It was 2 years ago, and she found that it didn't. But you're thinking about it in the right way, Julia, with all of those. What else makes men different than women, or women different than men? Anybody want to guess? Joffney, are you there? What do you think makes men and women different that might affect their VO2 max values?
I mean, maybe men are usually bigger, maybe, so like in size and height, so they have to produce more, or they'll be able to, their lungs has a better capacity of exchanging VO2 and stuff.
Okay,
That's just, I guess.
that's a good way to think about it. Again, because we tend to normalize it to body size, then some of that gets washed out. But you are absolutely thinking in the right way. That is in general, men tend to be taller and weigh more than women. But what's one of the other really key distinctions between men and women? Let me ask, I'll ask the question in a different way. Oh, John, you want to weigh in? Please do.
Is it because of testosterone in men?
It is partially because of testosterone in men. Yes. It's not just because of the hormone per se, but it's maybe a consequence of the hormone.
Is it because testosterone increases muscle mass?
Yes. Men do tend to have more muscle mass than women, but even if we have men and women who have a kind of an equal amount of muscle mass, women tend to have more of something else than men do, just kind of on average. Do you guys know what that is?
Is it estrogen?
They do have estrogen, Gavin, that's right. And that estrogen, and it's not necessarily the estrogen per se, but if we look at adolescent men and women, like sort of right before puberty, they look basically the same, right? And, and then after puberty, what's one of the other things that changes in women?
Body fat.
Body fat. Very good, Emma. Very good. Okay. So women, because of the wonders of childbirth and because of the sort of evolutionary need to have additional stored energy to potentially support childbearing, women have higher percentages of body fat than men do. Women that have basically no body fat, or what we would think of as sort of no observable body fat, are going to have maybe 18 or 20% body fat, whereas men that have what we would think of as sort of no observable body fat may have 4 or 5 or 6% sort of body fat. So just in a very general sense, right, women have maybe 10 to 12% kind of per, what you would think they would look like, more body fat than women do, or women have more than men. So Because of that, men tend to have more muscle, women have more body fat. So fat, or subcutaneous body fat especially, is not metabolically active tissue. It does not use oxygen. And so, because that denominator in our equation, that sort of weight thing, is made up of a higher percentage of non-metabolically active tissue in women, their values tend to be a little bit lower. There are some other things. They have a little bit smaller heart size. There's some issues in pulmonary function and hemoglobin concentrations, and those things are a little bit different in women than they are in men, that play a little bit of an extra role there. But in general, it's mostly due to body fat. If we can take men and women, and if you can find men and women that are almost identical in height and weight and body composition, then their values can potentially tend to be very similar. Okay. So good. Y'all did a really nice job of kind of thinking your way through all of those. So if we take and we look at the highest sort of values that we can get, if we look at elite male distance runners, so think of these as distance athletes, okay? Elite female distance athletes have VO2 max values somewhere between maybe 60 and 75 mLs per kg per minute, and men tend to be in the 75 to 85 range, okay? And so I believe like the highest ever recorded in a woman is like 77 or 78 mLs per kg per minute. And in men, it's like 96 or 97 mLs per kg per minute. Okay. Weirdly enough, the largest values very often tend to be recorded in female or male cross-country skiers, because anybody ever been cross-country skiing? That shit sucks, right? It's really, really hard. And you use your arms a bunch, you use your legs a bunch. And so they're used to being able to kind of train and have endurance capacity in almost all of the muscles in their body. Whereas if you're a runner, you use your arms a little bit, but you're not generating nearly as much force. And so we tend to see it in these kind of big cross-country skiers in that particular way, okay? We did a study a couple of years ago in my lab on differences in pain sensitivity in just kind of well-trained but not elite college-age men and women, and the folks that were on OU's cross-country and track teams that were male and female distance runners. And so what we found was that the women on the OU track team, were averaging out somewhere about like 65 to 71 mLs per kg per minute. And then we had the ranges in the men on the track team were maybe like 74 to about 80 or thereabouts. And none of them were particularly like the best distance runners, like even in the Big 12 or anything like that, much less kind of on like the whole of the NCAA, or if anybody watched the Olympic trials this past weekend. Okay. And so there's some other things that go into performance, but that's kind of what we're looking at and what we're working with. Okay. Now on the other end, okay, on the end of people that have pathologies, people that are post myocardial infarction. So if you're post a heart attack, okay, these people tend to have high levels of coronary artery disease. They tend to have very, very reduced cardiac outputs. They're at like 18 to 22 mLs per kg per minute. You have a pulmonary patient, you've got somebody that has pretty severe emphysema, or they have chronic obstructive pulmonary disease. They may be at like 13 to 15 mLs per kg per minute, okay? I could ask any one of you right now to stand up and start doing body weight supported squats for us, or to start doing jumping jacks, and do jumping jacks for about 5 minutes here while we all watch you in class. And you're very likely, while doing jumping jacks with your body weight, going to raise your oxygen consumption into probably maybe 25 to 28 mLs per kg per minute, depending upon how much you weigh and how fit you are. Okay. So imagine from this, people that are post heart attack, doing something like doing jumping jacks is going to max out their VO2 max. Walking, you guys go for a walk, okay? And you may be at 10 or 12 or 15 mLs per kg per minute of oxygen consumption. So if you're a pulmonary patient, walking, okay, is in essence maxing out your cardiorespiratory systems. So if we wonder why these people have high rates of mortality, if we wonder why these people have a hard time being physically active, it's because very, very simple kinds of things that we take for granted that are not particularly intense for an otherwise healthy person are unbelievably difficult and intense in these patients. And so that's why we need to find ways to train them and try to raise their values, because it will really improve their quality of life. Okay. And that's part of the reason why being able to test VO2 max and know what it is of the utmost importance to us. It doesn't matter in some ways that we know whether or not Emma has a higher VO2 max than Jenna does, or whether John has a higher one than Gavin or anything like that. It doesn't do us a lot of good right now, and you guys, okay? Because most of y'all, I would imagine, you can do whatever you need to do in a particular day. But in these sort of clinical patients that many of you guys are going to encounter in your future jobs, it really plays a big role. Even small changes in them can let them walk more, okay? Or let them get up a flight of stairs or something. And so we'll talk more about that when we get into cardiovascular disease and we get into aging, but that's the key thing here, guys, okay? That's why this measure of fitness is so important and so key to understanding all of the poor health consequences of having low fitness levels, okay? So there are some things that are going to play a role in what your VO2 max value is, okay? And so if we want to test someone and know where they are right now, then we need to understand these things and appreciate these things, because it's going to affect the number that we get. Okay, so the type of test that we do really matters. It really, really matters. Okay, to get a true measure of VO2 max, a true measure, we have to do a running test. We got to put you on a treadmill and have you run. Okay, that gives us sort of your highest value, and that's true for everybody. If I put you on a bike, which is what we most often will do, cycling is body weight supported. It's easier for everybody to get on a bike. You just sit there and pedal. Cycling in most people is going to give us a value that's maybe 90 to 95% of what we could get if we put you on a treadmill. Okay, so we're going to undershoot your max value just a little bit. We've done some work in my lab, in some previous studies, and it's oftentimes done in people that have problems with their legs. You can do arm crank cycling. So we just had people sit behind the bike and pedal the bike with their arms. And so you just crank like this and you just go, 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 go. When you do that, you tend to get VO2 max values that are maybe 60 to 80%. Usually they tend to be somewhere between about 70 or 75% of what you get with running. Okay. It's one of the weirdest tests I've ever done in my life is to do an arm crank VO2 max test, because you finish the test and your arms are dead. You can't turn the crank on the bike anymore, but yet you're not actually breathing that hard. You're like, I'm not that kind of tired and out of breath like you would normally think of if you had run or you'd done a bike, where you're just like, man, I'm just really kind of maxing out ventilation and things. You're like, my arms won't work, but I'm kind of fine. It's a very strange kind of thing. Okay. So people will sometimes call these cycling or arm crank tests, rather than getting a VO2 max, they will say that you've gotten a VO2 peak. Okay. It's the highest value for that particular test. And there have been lots of historical debates in exercise physiology about what makes a max versus a peak. And people get very, very fussy about all of those things and very semantical about all of it. Basically, anything that's not a running test is considered a peak test. And then there's even some instances where people, if you don't see a plateau during a running test, they want to call that a peak test. And I get really mad at those people, because I'm like, do we really give a shit about all of this? Like, we're arguing about the wrong things in that way. But that will come up in your future classes. It will be a thing you all will talk about in exercise phys. If you take exercise physiology lab class, you'll do the different kinds of VO2 max tests. And so it will become an important thing. Okay. So I just want to introduce the terminology to you, but I think it's a distinction that's not the best kind of thing. I usually just call every test we do, we just call it a VO2 peak test, and that way we can avoid all of those things. Okay. Other things that influence your fitness levels: genetics. There were some really, really cool studies done in the 90s on sets of twins, and what they found, they did twins, and then other, like if they had other brothers and sisters that weren't twins, they tested moms, dads, and then the kids, and then they even got grandparents if they could. And they have found that somewhere between maybe 25 to 40% of what your VO2 max is determined by genetics, okay? And so this genetic component is going to involve things like muscle fiber type, okay? It's going to involve things like heart size. It's going to involve things like hemoglobin content, okay? Blood volume. And then we now know, and we've actually hired our new faculty member that's coming and going to start in the fall. The thing that she studies is she studies the genetics of mitochondria. And we know that there's a genetic component that some people have mitochondria because their parents gave them good ones that function better than other people. Some people genetically have more mitochondria than other people. And so these are the things that are going to kind of be determined. And so in a lot of ways, if you're a good endurance athlete, thank your parents. Okay. Yes, maybe you ran a bunch or you cycled a bunch and you've worked very hard, but you got a chance to be in the game because you've got good genetics. Okay. Training status also really, really matters. People that run or bike or walk or those kinds of things within their kind of genetic potential can move themselves up and down because of their training status. We already talked about that sex plays a big influence. I say big, I mean, it plays a level of influence, with men tending to have higher values than women. Age plays an influence, mostly because age affects maximal cardiac output, or Q, right? Age affects max heart rate. The other part that happens with age is that people that are younger tend to have a better functioning cardiovascular system, better functioning pulmonary systems. And then altitude and air pollution also play a really, really big kind of thing. If we send you to altitude, I got sucked into watching last night a documentary on Netflix about black holes, because that's sort of what I do with my life. And they had a telescope. They put their telescopes to study black holes. They're all up on mountains, basically, because there's less atmosphere. And so they had one, this really new fancy one on a mountain in Mexico that was at like 16,000 feet. And you go up there and like walking around, people are getting out of breath. Like you can't just immediately go to 16,000 feet and like run. There's less air, so you can't saturate your hemoglobin, so it goes down. And then air pollution also has a big thing. If there are particles and things in the air, then it's going to impair lung function, and that has some really kind of big consequences to things. Okay. So we talked about disease. I don't really care that you guys, we're not going to talk about much of the stuff that is going to be on here. Okay. So we can measure oxygen consumption in what we call an absolute value, which is just liters of oxygen per minute. It's rarely ever done that way. All the values that you see, all the things that we talk about are what we call a relative VO2. And that's where we have taken your absolute VO2 and we've normalized it to body weight. Having the absolute value doesn't really give us very much. And so pretty much everything is relative. We also talked about on like the very first or second day of class about this idea of a MET, or a metabolic equivalent. And so your resting metabolic rate is one metabolic equivalent. And then we can characterize any kind of activity as sort of a number of METs above resting metabolic rate. So generally we say that one metabolic equivalent, or your resting metabolic rate, in pretty much everybody is about 3.5 milliliters per kilogram per minute. So if you're doing exercise, that's 2 METs, you're at 7 mLs per kg per minute. Or if you're at 3 METs, what would that be? That's at like 14 or something like that. Okay, so I just kind of want to give you those numbers, but I'm not going to ask anything really arduous about all of that. We've talked about maximal test, okay? So up till now, everything I told you about was this. What we're going to do in the lab, and what a lot of people do with these things, is something called a submaximal test. And so what we do during a submaximal test is we have you exercise, and we're going to take you up to usually it's a particular heart rate, okay? Some percentage of your maximal heart rate, which we can guess at approximates some percentage of your maximal cardiac output. And based upon how fast you were running or how much power output there was on the bike when you reach that percentage of your maximal heart rate, we then will estimate or kind of extrapolate from there what we think your maximal oxygen consumption is going to be. Okay. There are, I don't know, off the top of my head, 8 or 10 or 30 different potential submaximal tests for estimating oxygen consumption. We do one in the lab for this class. You do a different one in personal training. You do a different one from that in strength and conditioning. And then you do 2 other additional ones in some of the other ones. So there's a bunch of different ways to do this, even though they're all relatively similar in what they're asking you to do. Okay. And so the idea behind them are that if there is some sort of thing about work rate, and as we increase work rate, right, your oxygen consumption is going to go up like this, okay? And that if we have you work to a certain place that's not your max, that gets us to a certain point on this curve. And if we can measure things at several points down here, then we can fit a line to all of this, and we can guess at sort of where you need to be out here at your very, very max, okay? And rather than measuring oxygen consumption, what we end up measuring is heart rate, because as I'll show you guys in the next couple of slides, your heart rate graph looks just like your VO2 graph. And so if we know heart rate, we can guess at VO2. So there's some things that we're going to do out of all of this, okay? You don't have to know anything about the names of the test. If we were in person, we would do something called the YMCA bike test. There's another bike test that's called the Ostrand rhyming test. You can do things on the treadmill. The most common thing that's done on the treadmill is something called the Bruce protocol. The Bruce protocol, if you go to a hospital and somebody has had a heart attack and they're going to do a cardiac stress test on them where they put them on a treadmill and they have them do some exercise, they follow very, very generally, they follow the Bruce protocol. That's probably the most commonly used one. And so you start off walking at a particular incline, and it increases speed and it increases incline every 3 minutes. And you just go until you either reach a certain percentage of max heart rate, or if you're in the hospital, you go until you can't go anymore. Okay. But there's about 18 different ways to do it on the treadmill. You can do it on the bike. There's a bench stepping version where you step up onto like a 18 centimeter tall bench, and you go at a certain rate and you increase the speed that you're going every couple of minutes. We measure your heart rate. So there's pretty much pick an exercise, and we can do a submaximal estimation test to try to get your VO2 max from all of that. Okay. The one we're going to do, that I'm going to assign tomorrow and you guys will have over the weekend to do, the one you guys are going to do is even simpler than all of this. All we're going to do is I'm going to ask you to walk for 6 minutes. And you're going to see how far you can walk in 6 minutes. Okay. And we're going to measure your resting heart rate, and we're going to get your age and your resting heart rate, and whether you're a man or a woman, and how much you weigh. And from those things, with the amount of distance you cover in 6 minutes, we can get a surprisingly accurate estimate of what we think your VO2 max is going to be. Okay, so the 6 minute walk test is used a huge amount in clinical populations. When we do things with people that have, like Dr. Larson uses it with her MS patients, it's used a lot in kids, and it's used a lot in older adults. You just have them come in and they walk, and you figure out, you just go walk as fast as you can for 6 minutes, and then we can do these kinds of things. So it's surprisingly accurate, okay? So The crux of most submaximal tests, though, is the relationship between heart rate during exercise and oxygen consumption level, okay? And so if we do a graph of these things and we graph everything else out, that oxygen consumption, as it increases, heart rate also tends to increase, and there's this very nice linear relationship between these two kinds of things, okay? And so what that tells us then is that if we know what your heart rate is, and we know what your resting heart rate is, and we know what your age predicted maximal heart rate is, then we can guess at basically what your percentage of oxygen consumption you're doing during a particular bout of exercise. And that's how we're going to use, as we will see maybe a little bit today, but even more so tomorrow, why we want to use some target heart rate when we prescribe an exercise for you. We want you to go run today. I need your heart rate while you're running to be at approximately sort of these values, because that's going to tell us that you're getting enough intensity, because a heart rate of that amount is going to correspond to some oxygen consumption value. And we want those things to be at the proper percentage of your max so that we can know that you're working hard enough to get overload and to cause yourself to adapt. Okay. Okay, so this stuff is pretty straightforward. Don't worry about this, okay? I am not going to ask you questions. This is usually, we do this and then we talk about the YMCA bike test, and then we do this, and then we do it in lab, and so that's why I kind of talk about it more so here in class. Don't worry about this particular slide, okay? All right, Emma, you put a hand up first, and then Julia, you were second.
Yeah, so my question kind of has to do with like when we're talking about prescribing a certain like percentage of VO2 max or a certain heart rate or whatever. So like on like my Fitbit, it's got those ranges of like, here's, you know, the cardio range and all that fun jazz. Like how accurate is that, or do we know? And is that like a good enough metric for like sort of casual working out sort of thing?
So great question. The answer is yes, we do know. I don't know. I would need to look. You would have to tell me, like, we'd have to look at specifically sort of what the Fitbit ranges are, like what their, you know, what percentage, how they're calculating their percentages, right? Or how they're calculating their ranges where they want you to be. But in general, yes, they can be. That's a very common, very valid way to do things. I will show you guys how we calculate something called heart rate reserve. And we can, based upon your resting heart rate, which tells us something about your fitness levels, and then your max heart rate. Your heart rate reserve is kind of the difference between max heart rate and your resting heart rate. So it's this reserve of heart rate that you can basically increase before you get your max. If I give you, say, a target heart rate that is at 70% of, say, your heart rate reserve or something like that, that is going to almost exactly correspond to being 70% of your maximal oxygen consumption. And so when we see what our guidelines are, that if you want to improve your cardiorespiratory fitness, you need to be at 50 or 60 or 70% of VO2 max. If I calculate my heart rate correctly, then, and you hit that target heart rate, it's almost exactly at that percentage of VO2 max. So it can be very, very accurate. So the science behind that is 100% real and correct and matters. How Fitbit or Orange Theory or the treadmill you're running on at the Huff, how they're terming their zones, there's a little bit of kind of gray area in the midst of that. But the theory behind it is 100% correct. So you will be able to, when we are done tomorrow, you will be able to, if you can track your heart rate on your Fitbit while you're working out, know exactly where you need to be and if you're doing it correctly. Whether Fitbit thinks you are or not, you will be able to figure that out. Also, Emma, you're not like driving while you're asking me questions, right?
No, I'm parked.
Okay, good. I'm just like, let's not do that. Like, we can wait and get someplace. I don't want anybody to have a wreck while we're all sort of watching here. That would be bad. Okay, Julia.
So based on the graph that you were showing with the heart rate and the VO2 max, would then my max heart rate correspond to my VO2 max?
Yes.
So, okay, in theory then, if someone who is my age would be would have the same VO2 max, given that they don't have any like problems.
Okay. So that's a great question. Again, a great question. So what that tells us is that regardless of what your VO2 max is, okay, you and John may have very different VO2 maxes, okay? And then I don't know if Addie is here today, but I know that from our conversation the other day during brunch that like Addie was a distance runner in high school. And so you guys may have different states of training. You may have very different VO2 max values, but if you're the same age, then during a particular test, if we get you to a place where you have basically reached your age predicted max heart rate, what that tells us is that you've probably reached or are working at your max or very near your max VO2. But what may happen, Julia, is that you can run at 7 miles an hour at a 10% grade. And that's the intensity of exercise that will get you to your VO2 max. Whereas maybe John, he can run at 12% incline at 12 miles an hour. So he's going faster at an even higher incline before he gets to his age predicted max heart rate, which is identical to yours. And what that tells us basically is that when you've reached that max heart rate, how much work are you doing, right? What's your power output on the bike? What is your speed and incline on the treadmill? And then whoever has the higher one of those, it's that work that's being done at that's going to tell us what your actual kind of raw VO2 max value is. Does that make sense?
Yeah, so in order to like compare the fitness level, we can't just take into consideration the VO2 max, but we also need to take into consideration how much work each of us is doing to achieve that VO2 max if we're the same age.
Right. It's really how much work are you doing to achieve a given heart rate? Because then the heart rate thing, both heart rate and work rate are going to correlate to VO2 max, but the heart rate just sort of tells us where in your range, right? Are you at 70 or 80 or 90% of your VO2 max? Whereas the work rate is the thing that tells us like, is your VO2 max 40 or 50 or 80 or something like that, if that makes sense.
Okay. Yeah. Thank you.
And so when you guys do your 6-minute walk test, what it basically tells us is whoever can walk the farthest per their resting heart rate and per their weight over the course of 6 minutes is going to very likely have the highest VO2 max. Okay. Okay. So again, I'll just put a big line through. Don't worry. What happened? Big line through YMCA bike test. Don't worry about these kinds of things. Okay. So there are some other what we call field tests to be able to try to measure VO2 max. There's a lot of different ones. What you guys are going to do in lab this weekend is a field test, but you can do a 1 mile walk test. So you basically walk a mile and whoever walks it the fastest probably has the highest VO2 max. You use that with age and weight and sex. We're going to do, rather than go a mile, we're going to do the 6-minute walk test because it's shorter and things. There's jogging tests, there's running tests. You guys probably remember maybe when you were in elementary school or when you were in junior high and you did the presidential physical fitness test maybe, and you had to run a mile or a mile and a half, and you had to go at a certain amount of, like, you had to take a certain amount of time to try to see those things. We can, based upon assuming somebody is going as fast as they can, we can use that as a way to estimate things. The key take home though is that field test and estimation test, submaximal test, have more error in them than actually directly measuring oxygen consumption and doing some kind of maximal test on the treadmill or the bike or something like that. They're very good. They're very useful. They're cheaper. They're easier, right? What I'm going to have you guys do is basically you're going to put a free app on your phone, and it's going to track how far, you can set your timer for 6 minutes and it tracks how far you walk, right? You can get out, you can walk, it requires nothing, basically. Okay. Whereas if you want to do the real lab test, you got to have a, like a several $1,000 treadmill, and you got to have a $20,000 metabolic cart and all of those kinds of things. Okay. So there's ways to do this that are going to get us reasonably good values. Okay. Reasonably good values with everything. Okay. Here's just some advantages and disadvantages of field and lab tests. They're pretty sort of kind of pretty obvious. Okay. So what I'm going to do now is we're going to stop sharing. We're going to do one slide, and I'm just going to tell you guys the big take home for, hey, here are the adaptations that take place when we train aerobically. If you run, if you bike, if you elliptical, et cetera, here's what is very likely going to happen to your VO2 max. Okay. And in some ways, to me, this just kind of big picture. Here it is, done. Then we're going to transition though, like, look, if this is what we know is going to happen, what I want us to spend some time on is how do we train? What do we need to do? How many days per week? For how long? Like, what should you guys actually be doing if you want to raise these things up? And so what we're going to do is we'll do that one slide. Then I'm going to put you guys into breakout rooms. And then we'll actually have you all put some stuff together on what you guys think you should do, right? If you were going to go today, how would you go and train? And, is that right? Is that wrong? Kind of why or why not? Okay. So we'll do share screen, and we'll do kind of one slide here. So much like what we saw with strength training and kind of maximal strength training, okay? Most of you guys, almost all of you guys, have a reasonable capacity with proper training to increase your VO2 max, okay? And it's going to depend upon a whole host of factors and things like your initial state of training and your genetics and a bunch of those things. But generally, people are going to be somewhere in this 10 to about 40% of an increase, okay? And so what that means is that, let's just say you're a typical college-aged woman and you have a VO2 of 40 mLs per kg per minute. It is very, very reasonable for you guys to expect that with some kind of proper amount of training, very easy, I would imagine, for most people to get maybe all the way up to, say, 50 mLs per kg per minute, okay? So that 10 ml% increase, right, that's a 25% increase in what your VO2 max is, okay? And so, so you can imagine kind of in the range on those kinds of things. All right. Now, in some people, you may be, the 40% is kind of the kind of average top end, but there may be some people that can get 80 or 100% of an increase. And there are, unfortunately, some of you guys that no matter what you do, you can't make your VO2 max go up. You're these big kind of training non-responders. And that's something that you should maybe scream at your parents about, that it's their fault, that your genetics are just not set up to allow you to do all of that. Okay. So I can't make, with proper training, I can't make probably hardly any of you guys into kind of elite distance runners. But what I can do very, very much so is I can make all of you significantly better endurance athletes. Like, I can make you, be able to run a 5K or a 10K or a half marathon or even a marathon significantly faster than what you're doing kind of right now with training. Unlike strength training, in some ways, where there are some people that their muscles just aren't going to get that big and they're just not going to get that much stronger, we can make our endurance capacity go up quite a bit. Okay. So if we see this, 25 to 40 or 50% increase in VO2 max, why does that happen? Well, over time, when you train, your skeletal muscle makes more mitochondria. Okay. What we know is that if you do it correctly, you can, for the most part, almost double the number of mitochondria in your skeletal muscle in both slow twitch and in fast twitch muscles, okay, or muscle fibers. You get twice the amount of muscle, of mitochondria. So now we're working on that end of what is happening with our ability to use oxygen that can be brought there. Don't worry about lactate threshold. We talked about that the other day a little bit, but it's a little more complicated concept that I don't really want us to get into very much. But what we tend to see on the kind of delivery of the cardiac side or the pulmonary side of things is an increase in total blood volume, which helps us to increase stroke volume. Okay. And these two things together lead to an increase in cardiac output. Okay. And so what happens is we don't see a lot of changes. If you have normal, good pulmonary function, you don't get better pulmonary function. Okay. It's hard for us to train to get adaptations on the pulmonary side of things. You can get some in your diaphragm and stuff. And that may matter a little bit, but in general, we don't see real pulmonary changes. The changes that we tend to see are you get more blood. By having more blood, you physically have more red blood cells on which to put oxygen. Also, by having more blood, you can increase preload, which makes your stroke volume go up. And so your stroke volume going up can give you a larger maximal cardiac output. Training has absolutely no effect on max heart rate. Okay. So when you train and you get better, your maximal cardiac output goes up. It has nothing to do with your heart rate. Your max heart rate is whatever it is, and it's generally related to age. We cannot train that away or out of you in any way, shape, or form. Okay. Where training does have some adaptations is your resting heart rate tends to go down, or your heart rate at any given work rate, like running speed or something, will tend to fall as your VO2 max goes up. But that's because of this increase in stroke volume. So you can get the same cardiac output out of a lower heart rate. Okay. So this is kind of what changes. All right. That's the stuff that changes. So I'm going to stop sharing. So what I'm going to ask everybody to do is I'm going to resume recording. Okay, so we're going to go through now what you guys have put in the chat. So Addie's group, which was Taylor and Addie and Jessica, said you should run 5 days a week consistently while slowly increasing your distance and then slowly increasing your pace when you get to a good distance. So I'm gonna go run all 5 days or all 5 weekdays next week. Is that kind of what you guys had in mind from all of that? Okay. And you said, I need to increase my distance until I get to a good distance. So where should I start? What should I do? How far should I go run?
We said like a song, like pick your favorite song and then run the distance of your song. And then like the next day, pick another song and then run 2 songs or whatever. And
okay.
then Jessica said to like walk a 100, run a 200, walk 100, 200. So
okay, that seems like a very reasonable. And then you said when you get to a good distance, we need to increase our pace. So how would I know what my pace is when before I'm trying to increase it? What should my pace be? And then also, how are we defining like what's a good distance?
The distance you want to get to. So like if you want to run a 5K,
okay,
that's getting to the 5K distance and then start working on your pace.
Then working on my pace. Okay. So if I'm not used to running, how fast should I go run today? How do I do that?
Like as fast as you can comfortably.
As fast as I can comfortably. Okay. What if I can't run comfortably ever? Right. My wife is here. She's eating her lunch. And Leslie, have you ever been able to run comfortably at any distance?
Yes.
She says yes, but if we ever try to go run, she likes walking more than running.
Oh, I was real serious about it.
Okay, she's now saying she was real serious about it, so she probably was. But like I don't find running to be particularly comfortable ever. My dad can just go and run and run and run and run and run and whatever on all of this. I don't understand those people. They're like, I run and it's fun and I enjoy it. I'm like, bullshit. There's no way. On all of that. Okay, so get a good distance. Then once we've gotten our distance, then we can kind of increase our pace. Okay, seems very reasonable. 5 days a week though. That scare anybody? Like you had to tell if anybody has a parent that is never like doesn't run or doesn't do anything, they got to start like, hey, you're gonna go 5 days next week. We're gonna go do this all 5 days. Do we think that's a little ambitious, Or do we think it may be physiologically correct? Do we think that's going to be a thing that might scare people a little bit? Any thoughts? Madison, you were nodding your head like that seems like a lot, or that might spook people. Oh, wait, now Madison's frozen. Oh no, all of y'all are frozen. It's got to be me.
You're back.
I'm back. Okay, hold on. I don't know what's happening. Uh-oh. Okay, wait, now I see you guys moving around. Can y'all see me? Can y'all hear me?
Yes.
Okay. Was I like frozen? Was my mouth open like in some weird sort of place? I'm always terrified of that. Madison, I was asking you were nodding your head and saying like 5 days seems like a lot, or that might seem like a lot to some people. What would you recommend they do otherwise then? If 5 seems like a lot?
Well, any running seems like a lot to me. I'm kind of like you. I don't like running. I don't understand why people would want to do it. But my group kind of came up with like, so I took endurance training last semester, and we talked about how like if you want to increase your endurance training, you also need to work on strength training.
Okay.
And so we kind of made like for 3 weeks, like we would do 2 days of endurance training and then 2 days of strength training and then rest, like 3 days of rest, because obviously that's going to be a lot. And then once you like kind of get in the groove and like get your strength up and endurance up, then you would run for 3 days and then do strength training still for 2 days, like still trying to keep your body like strong and everything, but still running. But I think that like kind of going from strength training to endurance training, like mixing it up is also really good, because like I feel like you can get bored just like running a whole bunch. I don't know. That's just me. That could be totally wrong. I don't know.
Well, you cheated and took a whole class about endurance training before doing this. So your level of answer expectations have just, your groups has just gone up significantly since you've had a whole class about all of this. Okay. So Jessica, you're in Addie, y'all's group. That seems like a very reasonable thing. Let's move on to our next one. So we've got Joffney and Ireland and Julia. You guys say if it's a new person, follow the recommendations that state 3 days a week, moderate exercise for 30 minutes, or go running for 25 minutes vigorously for 3 days. As you improve, you can do intervals to get used to the distance, jog and then walk and then jog and then walk. Okay. Once you're able to run it, we'll focus on cutting time by trying to run intervals at a faster rate. Okay. That seems reasonable. So you guys are saying 3 days a week for 30 minutes, and you said that was based upon some recommendations. So what recommendations are those? Where'd you guys find that?
That's the one that you taught us, the ACSM, right?
Yes, the physical activity guidelines. That's right. Yes. There are some ACSM recommendations in the coming slides on exactly what you should do from a like running or biking standpoint. And I was wondering if you guys had maybe peeked forward and looked at that. So, okay. That seems very reasonable. What if I can't go 30 minutes? What should I do?
Like you can't walk 30 minutes, or like?
Maybe I have COPD and I can't walk 30 minutes.
Well, I mean, we'll just go as far as you can, and we'll work from there.
We'll work from there. That seems very reasonable, Johnny. Very reasonable. So y'all are at 3 days per week. I like 3 days.
Yeah, because we wasn't sure if it was like an experienced person or if it's somebody new,
I like 3 more than 5 just because I'm lazy, and those kinds of things. But that seems like a reasonable thing. Okay, y'all are all kind of very similar though. So we're going to start. We're going to do something. We're going to try to do more as we get better at that. And then once we kind of get where we can do our distance, then we're going to start wanting to go a little bit faster in some way. So that seems very reasonable. So now we've got Blake and Emma and Wyatt. Oh, wow. Y'all have like broken down by like distances. So week 1, Monday, Wednesday, Friday, run a mile, run 2 miles. Then the same. Then it's run a mile, run 3 miles. time your runs, aim to beat your time. Okay. So y'all are just like, let's just go do, so how long does it take me to run a mile? Like, what do we think from a time standpoint? Like how long does that take?
Well, if you're like me and you don't do a lot of running, like too long.
Okay. But look, I'm going to go run. Like, what does that mean? Is that 10 minutes? Is that 15 minutes? Is that an hour? Like, what's
Well, if you're me, it's probably 15.
Okay. 15. Okay. Why are we're like doubling? Why is it 2 miles and not like a mile and a half or something? And why in week 3 are we just doing a mile, and then 3? Why aren't we going up on the other days as well? What was your thought process behind that?
Wyatt might be better at answering this because he's like ran before.
Okay, Blake's now passing the buck to you, Wyatt. He's throwing you
Yeah,
under
so
the bus.
I used to run half marathons. So I kind of
Okay.
went off of what I did. So what I would do is like 5 days a week, I would run like 3 miles a day. And then on the weekend I'd do a long run. So I'd go like 7 miles, and then I'd try and increase as much as I could to where on the weekends I was running almost a half marathon just to kind of train. And so we kind of went off that, but we obviously lowered the distance because people don't want to run 3 miles.
I'm just kind of being a pain in the butt. That sort of way of doing things it's a very common in the sort of in the endurance training scheme of things, where you're going to do stuff during the week, right? That's at kind of a more moderate distance. That's pretty similar. And then you have 1 day a week where you try to do a longer run. And we'll talk a little bit about why that may or may not be a good thing here in a few minutes. Okay. So very reasonable. Okay. Madison, Shakota, and Jenna, 3 days a week. Our 2 endurance days, our 2 strength days. You got to be a really good distance runner to really then benefit from the strength training. We won't talk about that. But there is some evidence that is actually correct. 3 days of rest. Okay. You can pick those things. Good. We already mentioned that a little bit. Then we got Jacob, John, and Gabby. Different intensities while increasing duration throughout the week. Approximately 2 days a week, add strength training. So maybe you guys can't see that. They just sent that to me in that particular way.
So sorry, do you want me to resend it to the class?
Yeah, please do, Jacob.
Send it to you. Okay.
So I'll ask out of all of that while you guys are doing this, while Jacob is resending. So different intensities, like, well, how do we know what our intensity is? And that's the one thing on all of this that I want you guys that we've not really defined very well. So you guys are like, okay, do this number of days. That seems reasonable. Go for a half an hour or run a mile or run 2 miles. But how do we define intensity, right? What's going to be the key thing that we need to do there that really none of you guys have kind of zeroed in on? It was like, just kind of do it. If it feels okay, that's fine. And then try to go a little faster or something. But we have to have, right, a better and more precise way of doing that. So what would you guys think we should do?
You can use percentage of VO2 max, but I feel like with running, since there's a very high psychological influence, like you're doing the same repetitive motion over and over again, so it can become boring. I feel like the way that you feel plays a bigger role than your actually physiological capacity when it comes to how fast you can run and how long you can run for.
Okay, what you said, Julie, so there is certainly a large psychological component to things. That is absolutely true. But even if I'm supposed to use some percentage of VO2 max, like what percentage? How would we get at that? Right? So like, how do you guys know? So I'll ask it this way. Wait, nope, Gabby is not here with us. I was going to ask. So Gabby's a pole vaulter on the track team. And so while she doesn't have to run, she at least watches she's aware that the other people on the track team have to run. And so a lot. And so I was going to be like, hey, Gabby, how do they pick out what they were training at? So I'm sorry, Addie, to keep kind of going back to you. But when you were training, how did you pick how fast you were going to run? Like, what was when they said try to go and do this or try to go and do that, or did you monitor anything while you were running to know if you were at the right kind of pace or something? Like, how did you guys go about that?
We had I had an Apple Watch, and it told me my heart rate and stuff and told me my distance.
Yeah.
But we really didn't get a choice on how fast we ran.
You just said, go do this today.
Yeah. Our coach would always be behind us, with a bike and a dog. So if you weren't running faster than him on the bike and the dog, you weren't on the team. So you didn't really get a choice.
Okay, now the dog wasn't mean or anything. The dog didn't.
No, he was really nice. Yeah.
Okay, he was just riding the bike, or she was riding the bike with the dog, just sort of getting the dog some exercise. Not
Yeah.
here is this mean dog behind you. You got to run away from the dog. Okay.
No.
Okay, that seems better. Okay. All right. Well, I would argue that's maybe not the most scientific or ethical way of doing things, but okay. In the midst of that. Wyatt, you said you had trained to run a half marathon. How did you pick or keep track of how fast you wanted to run on a particular day? Or did you just go and I'm here's kind of what I feel like, so I'm just running?
So when I was doing it, I read a lot of books about running and stuff. And one of the main things that they kind of recommended just to prevent injury and kind of prevent fatigue, especially on long runs, is interval running. So I kind of would just go with an interval. So I would run 3 minutes, walk 1 minute.
Mm-hmm.
And so that would kind of define my pace, kind of define my time. Because if I was doing the interval, it would, round out to however long it took me to run, depending on how fast I was running. But
well,
usually,
how did you pick how fast to run? I know I'm kind of beating a dead horse here, you guys, but I'm
so
really
with distance running, I would do kind of a stride, so just a consistent pace that I wouldn't tire myself out too much, but also I knew that I was doing enough to benefit from it. Not that I was doing just going too slow, I would say.
Okay. I'm hearing a lot of gray area, a lot of feel, a lot of it's kind of this if you told your parents, hey, you're going to go run today and I want you to just get a consistent stride and just kind of, just sort of run ahead of this bike or something, right? That's maybe not the most scientific kind of way of doing things. Okay. And so what I want to tell you guys, and what I'll kind of pull up now on some things. So in a big picture in general, you guys did very well. Okay. What you guys have, most of the stuff would work perfectly well. You're pretty close on the kind of number of bouts in a week and maybe the time that we want to do things and all of that. But the place where we could do better, okay, much like with resistance training, the place where people mess this up is they mess up the intensity, okay? And there are now, because of the advent of Fitbits and Apple Watches and kind of reasonably priced things, there's some pretty reasonable and kind of cost-effective ways for us to get a much, much better idea of what your intensity actually is, and to be much more precise at making sure you're where you need to be. Because I can tell you, if you don't run fast enough, which if you're me, I don't want to run fast enough, right? Because it sucks. Running is not fun for me, okay? Everyone else is on their own, but if you enjoy it, you're a psychopath. I kid, but that's kind of how I feel about those things, but there's a very precise way. Okay. And so what you probably are realizing at this point with everything is that what we want to do is we really want to look at heart rate. Okay. We really want to look at heart rate. And I'll tell you guys a little bit more about kind of why that's going to be in just a minute. Okay. So the reason that we need to know and care about duration, the number of times we're going to exercise per week and frequency, the duration of our training, and the intensity is that all of these things are going to work together to get us something called training volume. And the idea behind training volume is that when we want to prescribe aerobic exercise, just like with resistance exercise, what we want to be able to do, right, is we need to overload you. We need the amount that you are doing, which is some kind of combination of the number of days per week, the time that you're going in each bout, and the intensity of those individual bouts, we need to be able to overload. So it needs to be more than whatever it is that you're accustomed to doing, okay? And so we can change any of these kind of components of all of this, and we can increase your volume, and then in theory, that will hopefully drive an increase in VO2 max, okay? So what do we need to do? What's kind of a good general kind of way to look at all of this? And so what I'm going to tell you guys in this particular slide is only going to relate to increasing VO2 max, okay? So if I want to make my VO2 max go up, these are going to be my recommendations for kind of where we need to be and what we want to try to work on, okay? If you're going to run a half marathon or a 5K or a marathon, or you're going to do something else that may not be exactly specific to this, then you may want to also train in some other different ways. So what I'm going to tell you is what the research tells us. If the only thing that you cared about was to increase your VO2 max, here's what we know, okay? The single most important thing to make your VO2 max go up during training or with training is the exercise intensity, okay? It's way more important that you go at a higher intensity than it is than if you go for maybe a longer duration or if you go more days per week within kind of a reason, okay? This is the most important thing. And we'll talk at the very end, probably not today, it'll probably be tomorrow, as we're kind of getting near to a place where we should probably cut this off, about where you can do really, really high intensity training, where you run really fast for very short periods of time, and then you let yourself recover and you do it again. And you do that a few times and you can actually make your VO2 max go up to a similar extent as doing kind of what people think of as kind of traditional aerobic training. It's called high intensity interval training. We'll talk about that tomorrow, okay? But intensity is the most important thing. For most people, okay, for most people who are going to start off not very well trained, they probably need to exercise either walking, which if you're really untrained, walking may do this, or you need to jog, or you need to ride the bike or the elliptical at something that is roughly equal to or greater than 50% of your VO2 max, okay? So the amount of work that you're doing, the speed that you're going, needs to evoke an energy expenditure that is roughly half of your max, okay? That's where we would like to be, okay? In people that are more trained, it may need to be, say, 65 to 75%, okay, for people that are more trained. And so what that means is that as you get better, you got to start going a little bit faster in those ways. And so you can increase the percentage of VO2 max at which you're exercising by going faster, by going up a hill if you want to, or upstairs or something. Or if you're riding a bike, then you can make your pedal frequency go up, or you can increase the resistance on the bikes. Like if you go over to the Huff and you punch a thing, I'm at an intensity level of 2, but I'm going to pedal at 60 revolutions per minute. If I want to make it harder, I go at 80 revolutions per minute. And anything that increases sort of the work in that way, it's going to make the intensity go up. So it needs to be at least 50%. For most of you guys, it probably needs to be over 60%, okay? That's where we've got to be if we want that particular bout of exercise to have the potential to make our VO2 max go up. We'll do frequency per week thing, somewhere in the neighborhood of about 4 to 5 days per week is kind of the max amount, right? So there's probably a dose response where we're going to say that 5 is probably better than 4, 4 is probably better than 3, 3 is probably better than 2, which is probably better than 1. Okay. But after about 5 days of exercise per week, okay, doing a 6th or a 7th day of aerobic training does not seem to be scientifically supported to get a further increase in our VO2 max. Okay. It doesn't seem to get us a further increase in VO2 max. So that's not to say you shouldn't do 6 or 7 days of aerobic exercise in a particular week. It's just that after 4 or probably 5, we don't get additional benefits purely from a VO2 max standpoint. Okay, that's our frequency component. Well, so how long should I go during each of these days per week at my kind of prescribed intensity or percentage of VO2 max? And what the research tells us is that increasing duration, okay, increasing duration up to about 40 minutes or thereabouts will get us a progressively larger increase in our VO2 max. So if you start off going for 10 minutes, that's great. If you keep the number of days per week the same and you keep your relative intensity the same, we're going at 60% of VO2 max. Going 15 minutes will get me a bigger increase in VO2 max than going 10. And going 20 will get me a bigger increase than going 15, so on and so forth. That seems to plateau off at about 40 minutes of exercise. Anything over 40, and you're not going to get additional increases in VO2 max, okay? Now, I can tell you guys that if you're training for some sort of running or cycling event that lasts longer than 40 minutes, you need to train, or you need to do stuff when you're training where you do bouts that last much, much closer to whatever your race kind of time or your race distance are going to be. You could, in theory, never run more than 40 minutes at a time and make your VO2 max go up as much as possible and then try to go run a marathon. And it's going to be really tough because, as Julia had pointed out, there's a lot of kind of psychological components to this. And while maybe you've maxed out what your VO2 max is, you're not accustomed to what it is like to run for 3 straight hours or 4 straight hours. Or I walked a marathon once and it took us like 7 hours or 7.5 hours or something. And it's a different kind of animal. It's not physiology in some ways, it's psychology in those ways. And so I always tell people that, yeah, you don't have to run. You don't have to go do that 15-mile run on the weekend. It may not actually be that much more helpful to make your VO2 max go up, but it's actually really beneficial from a psychological perspective because you can begin to understand what you're going to feel like, you know, the different kinds of aches and pains and what it's like to be bored for that long, which is my big issue with running, is you just get freaking bored all the time. So, but this is what we know, okay? You should go 3 or 4 or 5 days per week for maybe, 20 to 40 minutes at a time at an intensity that's going to be maybe somewhere north of 50% of your VO2 max. That's what we would tell people to do. And if you do that, your VO2 max will go up, and so your cardiorespiratory fitness will go up. So if you do these things, your all-cause mortality will fall, and you should see some kind of marked improvements in most of these things, okay? But that still hasn't really helped us to understand. If I said, right, in some ways, Jacob, do you know what your VO2 max is? Well, by Monday, you'll know what your VO2 max is. But if I said, Jacob, you need to go run at 60% of your VO2 max today, he's going to look at me and say, that's great, Dr. Black. How do I do that? My Apple Watch won't tell me, what percentage of VO2 max I'm at. My Fitbit won't tell me that. My smartphone won't tell me that. How do I know? And so what we want to do then is we want to use some heart rate value to try to approximate our intensity, okay? And that's where we'll pick up with things tomorrow. Okay, so I'm going to stop sharing. I'm going to